cell and delivering the oxygen to the intracellular contents, which are real important for the body metabolism. And these cells are rejuvenated, I mean, refreshed with oxygen. And they become active more. And generally, if there are disease cells or weak cells, they will be cured and they will start working normally. So this is the main golden pathway for hyperbaric oxygen therapy.
Perfect, sir. You have described the mechanism how hyperbaric oxygen therapy works. So at this stage, we also listened from you earlier that the patient having depression, patient getting unconscious or subconscious, and the patients having psychiatric problems sometimes, neurological problems sometimes, and the patients, those who work in underwater in the seashore, they have to take hyperbaric oxygen therapy. So could you please mention some more about that? Who should receive this therapy?
You know, I mentioned earlier that researchers are doing actively research on many diseases, new diseases. So in that case, cancer is also one disease which they are trying, because cancer is really devastating when it enters in the body and it never is being totally cured. Even for some benefit patients are getting with the chemotherapy and radiotherapy and operation, and these are the things. So they are trying for the cancer, but still the cancer being not found to be getting benefited until now for the disease, for the doses our doctors are giving. But they have mentioned one thing, that once there is a cancer starts going outside from the origin of the cancer. Say your cancer is in lungs. This lung cancer cell will go outside and it may go to your brain, it may go to your bone, it may go to some other organs. So this is known as metastasis, or distant distribution of the cancer cells. They are telling that if you use hyperbaric oxygen therapy, this metastasis will be reduced. Hopefully, they are expecting that metastasis or spreading out the cancer to the whole body may reduce, but still it is in research situation, not approved by FDA.
Sir, you have already described about one thing, that hyperbaric oxygen therapy provides in a chamber. Maybe laying inside the chamber, or somebody just having this, taking, reading to a books. Different sort of chambers are there. So could you please explain a little bit more about how this hyperbaric oxygen therapy delivered to human body?
Okay. Say, I'm trying to screen share. Can I screen share little? Okay.
Yes, sir. You can share it.
Okay. Sharing screen. You see, can you see Mr. Jainal?
Yes, sir.
Yeah, I can show you that these are the types of the different chambers. These are the types of different chambers, which is showing on the left side. And there are types of monochamber. Monochamber means only one patient will be there inside. Okay?
Yes.
And there will be chambers which are not mono, I mean multi-chambers. So usually mono chambers are more popular because this is the way that any area a patient will be given hyperbaric oxygen therapy. And there are also portable chambers, big chambers and the smaller, lighter chambers. So you see, this is one of the lighter chambers. This is the lighter chamber. And here, what will happen? Yeah. So this is the chamber. And you see here, a patient is inside. The face is seeing, right?
Yeah.
And this is there is a window here above. And there is a chain, I mean zip. Zip is here. So when the patient enters, the zip should be closed. And there is a meter you can see. And this meter will show you how much pressure is being given. And this is the way, and this is the connection for the oxygen and other things, generator, so that it gives the oxygen as well as the air. Air for the inflation of the chamber and oxygen for the patient. So this way, usually it happens that they usually gets the oxygen through this chamber. This is the portable chamber, you understand? And this is cheaper. And it can be moved from the house to clinic, from clinic to clinic, or house to house, like this. But these are, which I am showing now, these are the heavy chambers, usually heavy chambers. And usually these heavy chambers are transparent, and it's very costly. It will be more than, I think, not less than 3 crore in Bangladesh. And there are a lot of connections, you see, telephone, meters, and all these things are there. Sometimes they usually put a television here above the chamber, so that patient from here, they can enjoy the television also from inside. But usually it cannot go in, it cannot be given inside. So these are the ways how the chambers are working. I will show you one multi-place, because that is very important to understand what is really hyperbaric. Now you see, if I show this one, so many chairs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 chairs, so you understand how big this area is. And here, all the patients are sitting together, and they are receiving with the hoods, and they're reading books, magazines, while they pass their time. And so these are the known as multi-place. Multi-place means very big. You can see this one also here. The patients are there also. You understand? So you see, everybody is having hood. This is the hood, big hood. And through this hood, oxygen is being delivered. And they are very comfortable. This is the way. So this is the, how the oxygen therapy is being, hyperbaric oxygen therapy is being delivered to the patients in different areas. But in our country, it's not being started too much. In our country, you can get only these machines, hyperbaric therapy, oxygen therapy chambers in the, Sheikh Hasina burn and plastic surgery unit. There are few cases, few chambers they are using for the burn patients. For the burn patients, and those burn patients are getting benefit because the wound healing is very rapid through the hyperbaric oxygen therapy. Wound healing. It can be general wound also, but it can be burn wound also, because burn patients are really very bad patients, and usually they are having 80 to 90%, those who are dying mostly. So if you use this hyperbaric oxygen therapy for the higher percentage of burn, there is a chance that they may get better. I mean, they may survive. So these are the ways physicians are trying to help the patients of burn in our country. So if I just come back to the discussions, that lot of things are coming up. I mean, wound healing, diabetic wound. You see, for diabetes, a lot of people are losing their limbs, lower limbs. They go for amputation because their wounds are so bad that you cannot keep it. Surgeons told that you need an amputation. So they amputate the patients, and later they attach an artificial limb to their limb. So the whole life of this patient being little restricted, and also psychological pressure is there on these patients. Nowadays, through the hyperbaric oxygen therapy, those wounds are being treated and they are improving. Not all, but many of the wounds who would need an amputation. So they usually skip the amputation and they sustain a normal life later on. But it takes longer time because...
Thanks for watching. Please subscribe to your knowledge partner, Developing Bangladesh. Thanks for watching. Please subscribe to your knowledge partner.